Hi, this is Dr. Rudra, and today we are watching an episode where we have a live video of an extraction of a tooth, which is tooth number 36, in a 74-year-old male who is non-diabetic but was complaining of pain in a badly broken tooth. The tooth had actually chipped off before, and now you can see in these images we are giving the inferior alveolar nerve block along with other infiltrations and injections and nerve blocks as well as field blocks to numb the area. Now, once we have anesthetized the area, as you can appreciate in the video, we can see that the tooth is being luxated and the separation of the fibers, the gingival fibers, is being attempted with the help of a periosteal elevator. Always, as a rule, we always try to go for non-surgical extraction of even complicated cases first. And you will see in the following images that the moment we try to luxate the tooth and try to take it out, it breaks off, and hence this normal seeming extraction has now turned into a surgical extraction, for which what we are doing, we are right now sectioning the tooth into two halves so that we will separate the two roots and take them out in toto, try to take them out in toto separately. We are using the aerator to section the tooth under copious irrigation that is already seen in the aerator, and because of which you can see that we are suctioning so that the field is clear for the operator to operate. While it might seem challenging or disturbing to some viewers, please understand that the area being operated upon is completely anesthetized and numb, and the patient is not feeling a thing apart from a little vibration because of the handpiece. And we're attempting to further separate the tooth root pieces so that we can take it out in toto in separate pieces. You can probably see that the tooth is the tooth is composed of enamel, dentil and pulp, and the enamel being the strongest part of the body, it actually is making the burr stop. So that's where we have to be very careful, and we have to do it with a lot of caution. While it might seem easy to see, it is actually not. It is always better to attempt these extractions non-surgically first, but now you can see because the tooth broke, we have to separate the roots out, and now with a specialized handpiece to create a purchase, we are kind of creating a purchase point in the bone. Now, what is a purchase point? A purchase point is like a fulcrum kind of an area that is created where we engage the elevators and we try to luxate the tooth out. Now, this is also done under copious irrigation because of the fact that if we do it without any irrigation, the drilling, the heat generated can cause necrosis of the bone. That is why it is very imperative for us to do copious irrigation while we are doing the bone guttering. As you can see, we are creating the purchase point further and using copious irrigation. And while this may seem extensive, we will give sutures in the end, and this is the need of the hour in such a case where it has become a complicated extraction. We have already apprised that the swelling would happen to the patient, and now we are using the lever and the wedge principle to use the instrument to take out the root of the tooth, and again we're using the elevator to luxate the tooth out, and as you can see, the one of the roots is out. Now we have to attempt to take out the rest of the part of the tooth. And now we are trying to attempt to take out the other part also, and we are trying to see the socket, and we're elevating the tooth in its socket by creating lever and wedge principle. And this is not any rocket science, it's basic, just normal science, the lever principle. As you can see, the area becomes very bloody. That's why we are supposed to use sterile cotton and gauze to get better visualization and access. And now we are attempting to extract the other part of the tooth root so that it can come out. So we attempted it, at the same time we were not able to get it out. That's why we are doing some more bone cutting so that we can get a better access and purchase point to do the extraction of the remainder of the root portion. And here you can see that the bone guttering is happening under copious irrigation so that we can get a better purchase point for getting the tooth to be extracted. Now we are attempting the remainder portion of the tooth root to be extracted, and as you can see, we have successfully managed to take out the remainder portion of the tooth. And again, whatever that is left, we are supposed to shimmy it out, and we have successfully taken finally most of the tooth out. We'll examine the socket, and now we are giving the stitches. The stitches are given not too tight because we would experience and we would expect post-operative edema, because of which that the patient can have the sutures that can open by themselves and he can undergo a lot of duress and discomfort. So whatever sutures we give, we'll give them relatively light, and thereby we can get uneventful post-operative healing. Thanks for watching.